Shared Health and the Winnipeg Health Region use a common SAP system. After years of implementing our current solution across the province, we came to a point where we needed to do a significant conversion. The end vision of this project was to transition us onto the new S/4HANA platform, a move which would ensure system support well into the future. So our SAP system provides supply chain to all of the hospitals and the long-term care facilities in Winnipeg. We also have complex integration points to the systems as well for things like surgical instrument tracking systems, surgical information management systems. It's also the system that's used to deliver products to home care clients. It also pays about 36,000 employees. So if we're not up and running, there's also an impact to staff being paid. We launched in the midst of COVID. For the very first time, we were working with a 100% virtual team distributed across the globe. Often, projects of this magnitude will also institute a system freeze leading up to the actual go-live. Because we're healthcare, we're in the midst of COVID, we really did not have that luxury.
With respect to the biggest challenge, one thing which I want to highlight is on the cutover weekend, we had a 48 hours window to do the cutover activities. This included some of the technical challenges with how we were doing the conversion. We had to add an additional step into our process, which means it instead of taking around 2 minutes, this ended up taking 14 hours. So that means it significantly affected our cutover plan. So that emphasis on having that attention to the details was the key. As we are progressing in the project, we are continuously refining our cutover plan. Any adjustment we are doing with the cutover plan, the plan was getting reflected online. So if a task is taking, let's say, 15 minutes versus 20 minutes, then the plan gets updated automatically. So that means even though the team is globally distributed with multiple time zones, everybody can see the up-to-date information of the plan. We brought all our virtual team together, challenged each team members to see what efficiency we can bring. With the team consensus, we were able to look at the plan, make adjustment, and then when we were able to come out of that 14 hours delay.
We're very, very pleased. Our senior leadership was very, very pleased that we were actually able to get to end of job on that weekend without having to introduce a further delay operationally.
Again, the kudos goes back to the team. When you are challenged with the issues which we never faced in any of our conversion cycle, still have that mindset to get it done, never give up mindset.
Despite facing some of the significant challenges along the way, the S/4HANA project was a success. The project creates a foundation where we will continue to provide additional enhancements and capabilities for years to come.